Welcome back to the Daily Dope. I'm your host, Brando, and, well, there ain't a whole lot of updates for Kratom these days because we're still kind of waiting on the CIA and the FDA and the FBI and, the Border Patrol and ICE and the Gestapo and everybody else to make a decision as to whether they want to crack down on this natural herbal plant that is a remedy and can be used for many applications, and probably the most important of which is for opioid withdrawal symptoms and just overall replacement therapy and maybe helping people overcome opioid addiction in general. Not to mention it is effective for pain in a lot of patients, so it could be potentially used instead of opioid pain analgesics. Just a thought. Just, somebody that talks about cannabis in these terms all the time sees another herb out there that the government wants to pick on. And believe me, the FDA really wants to throw Kratom under the bus, as well as the people that have written into them and expressed that Kratom was this thing that they always scratch their head and they're like, I wonder if we had something safer out there that people could use for pain that isn't as addictive and doesn't, basically can't kill you. And I'm not saying that you can't abuse Kratom and Kratom can't be that thing that gets in your way or whatever, but at the same time it's and it can I've seen testimonials and heard people talk about how the health side effects of doing too much Kratom all the time might be pretty bad. So just like anything, you got to do everything in some kind of a moderate. You got to come to terms with something that you're gonna choose to do. And, all these things should be between a doctor and a patient. Or when it comes to natural, safe herbal remedies that are mostly safe, I think when it comes to that situation, we don't need doctors. I mean, no one ever told anybody that you needed a doctor to use St. John's wort for bipolar symptoms. But people do it. A lot of people swear by it. And whether you believe it works or not, it keeps them away from the Prozac bottle or whatever. So, I'm just sick of the government's attack on herbs and natural whole plant remedies because really, there's really no excuse. There's no reason to go after that. You can have all the death and addiction that you want to peddle. You can do that and still let us exist. Because we don't want your garbage anyway. You're not gonna, what's your end result here, Scott Gottlieb or Gottlieb or whatever your name is? What's the end game for you? For somebody to be strapped into a chair where you can administer the doses of pharmaceuticals to them as you see needed because they don't, because they refuse to take them, so you're going to force them to take that instead of maybe an herbal remedy? Is that where we're going with this? Because if you ignore this study here, that means you are a complete and utter shill for big pharma or whatever's got you over a barrel to say that Kratom is a bad thing and it's dangerous and it's not a good substitute for opioids and all these other things that you said about it. So, one thing we can say for sure is that we can do these studies. We can have studies about Kratom. And we've had studies before about Kratom, and you can go to the American Kratom Association website and see the science and facts, and you can go to other sources to look at other data if you want. It's not a Schedule 1 drug. So part of being a Schedule 1 drug that we have a barrier with cannabis is that you're not allowed to study it unless it's under super stringent and strict controlled environment circumstances, and you only get to use the cannabis that the National Institute on Drug Abuse provides you, which is garbage. So anyway, I'm going to go ahead and read this update for you about Kratom and a new study that just came out from Addiction Biology. Now, I'm going to tell you right now, I see these guys come up a lot because I look into this shit. And I'm going to give these guys a thumbs up overall because of their work and their study in many, many, many disciplines, or whatever you want to call it. Many drugs. I mean, here's the one right here that we're talking about. The one about Kratom. Oops, sorry. Yeah, right here it is. So, abuse, liability, and therapeutic potential of the Mitragina speciosa, Kratom alkaloids, mitragynine, and 7-hydroxymitragynine. We'll talk about that in a second. Wait, let's see if this full text really gives you anything different. I think all you get out of this is an abstract, yeah. And that's fine. We're not going to really even bother reading the abstract here, but just know that personally, I don't know what you think my word is good for, but I have vetted these guys before. This isn't the first time I've ran into the Addiction Biology journal. These guys have been on the mission. They do good work. They're not out there doing sensationalism and or whatever. They're studying addiction, man, and they're doing whatever they can to try to figure this out. So take whatever they say with a grain of salt, like anytime you ever have to deal with studies. But just know that these guys, do not like what the FDA is doing. All right. And I mean, for good reason. If you're talking about harm reduction, I mean, that's got to be the most counterproductive thing I've ever heard of, is saying that we should make Kratom a Schedule I drug. I mean, come on. And tell people that they can't use medical marijuana to treat pain or recover from opioids. Any of those things is so counterproductive to the cause that there's just absolutely no excuses left by people to push these terrible and horrible ideas that are not solutions in the least. So finally, let's read this. New Kratom science study at odds with FDA claim that Kratom is a narcotic like opioid. Because if you remember, the last big update was when the FDA basically said, oh, Kratom, that's a opioid. And everybody with a brain was just like, what? Are you fucking kidding? Now, you might say that they could say that because they could say that synthetic stuff is opioids too, just as long as it has a similar molecule maybe and it like does the same kind of actions. So if you can make the case for that, you can make the case that sugar is an opioid. You eat enough sugar, you're going to feel like you just took a Vicodin or two. It's just going to make you feel really heavy and a little bit tired, maybe a little bit spacey. But whatever. The American Kratom Association applauds the landmark science study published in the Addiction Biology Journal that concluded that mitragynine, quote, does not have abuse potential and reduces morphine intake. Desired characteristics of candidate pharmacotherapies for opiate addiction and withdrawal. And that directly contradicts the FDA claims on Kratom having the same effects as a classic opioid. Because one of the things about the opioid effects are the highly addictive nature of the actions of the drug. All right? It's no mistake that, people talk about opioid addiction like it's the hardest thing in the world to overcome. And part of that is the withdrawals. Those are the main things that we're talking about, Mr. FDA's guys over at the FDA and DEA. We're not talking about, this thing makes you like feel a little bit like you're on opioids and it makes it so you don't want to go do opioids, so it's got to be an opioid. No, we're talking mainly about the ones where if you do enough of it, you literally stop breathing and die. That's one of them. That's the main one. And if it don't do that, then we don't consider it like an opioid dangerous or deadly. And some people out there think opioids, at least a lot of them, should be on Schedule 1. Not that I don't agree with the Controlled Substances Act at all. So I don't care what you would do with a opioid scheduling, but it doesn't make a bit of sense that we took a normal plant like the opium poppy plant and we got it from a plant that kind of is addictive but not super bad if you just smoke the resin from it, all the way to like you got the most addictive substance known to man with heroin and things that are super highly concentrated past heroin like carfentanil and shit like that. That's just like thousands of times stronger than morphine. It doesn't make sense why we even have these substances on the planet, let alone how they can make their way into the FDA's scheduling as Schedule 2 or lower. It doesn't make a damn bit of sense. So anyway, the study, co-authored by Christopher R. McCurdy, Scott E. Hemby, Scott McIntosh, Francisco Leon, Stephen J. Cutler, isolated the potential high abuse of 7-hydroxymitragynine, or 7-HMG, when it is adulterated or concentrated in commercially available kratom products, but noted that 7-HMG constitutes only 2% of the alkaloid content of kratom, and as an alkaloid, it's actually a terpenoid. And what we know about terpenoids is that they have a really low flash point compared to I think that was on the previous search, but it was yeah. The evaporation points of terpenes and terpenoids are in the area of between about 70 degrees Fahrenheit and between 100 and 160, we'll say. The real stubborn ones can go up, pretty high temperatures depending on if it's attached to, really thick carbons. But it really don't matter, because the point I'm getting at is that you could safely get rid of the terpene 7-hydroxymitragynine quite effectively and easily in most preparations that you would do to do something like, say, get rid of the salmonella that might be in there, which is just bringing the heat up to about 160-ish or whatever for a little while. I mean, this isn't really that hard of stuff. This is just regular standard kitchen prep stuff. So anyway, this study can be found here. I'll put a link down below. Dr. Jack Henningfield, one of the world's leading experts on addiction and behavioral, cognitive, and central nervous system effects of drugs, highlighted the importance of this landmark study that challenges the FDA claims. Quote, "This is an important study that addresses the addictive potential of kratom using the most well-accepted and relied upon animal model. It shows that the major naturally occurring constituent responsible for the health-related effects of kratom, or mitragynine, is of very low abuse potential. A second substance, 7-hydroxymitragynine, that naturally occurs at such low levels in kratom that it might be of minimal health consequence, has a higher abuse potential. This has at least two regulatory implications. One, the finding does not support the FDA's claim that kratom is a narcotic-like opioid, and two, in regulating kratom products, FDA could set standards to ensure that no kratom product contains levels of 7-hydroxymitragynine exceeding those that are commonly present in kratom leaves and products. What they said earlier, like 2%, levels, which, I'm guessing that it still has some effects, but it's probably not something that people would miss if you took it out. And I don't even think, when they're talking about that people concentrate the 7-HMG, I don't believe that they're doing that on purpose just to make it more addictive and sell better when they make like the little concentrated extract bottles or whatever. That's just by nature, like, because you're concentrating it and extracting just the medicinal stuff out of the leaves of the plant. Yeah, naturally it's going to be more concentrated in higher levels when you're doing it in pure form. So you're going to be able to consume more of it than if you had to consume it with the additional burden of consuming all that leafy material. And if you don't know anything about kratom, it is a very leafy material, basically just ground up leaves of the plant, and that's what the substance is that you would consume directly, or it's kind of bitter, so usually people mix it with a tea or some kind of a juice. And yeah, okay, so to finish the article, the study also showed that mitragynine treatment reduced morphine self-administration, an effect consistent with the self-reported use of kratom to reduce opioid craving and use, and consistent with the conclusion that mitragynine is a predominant active constituent in kratom. So totally what everybody that sent comments to the FDA begging them not to schedule it, that's one of the main themes of those comments was, yo, man, this stuff really, really helped me overcome my morphine / opioid / opiate addiction. People that have been addicted for years. And they say function and live a normal life. Whereas, you know, on all those opioids all the time, they were, whether they were addicted to opioids for one reason or another, or it was just because they had some insurmountable chronic pain going on. I mean, to come out of that kind of a shadow of life for so long, you know, even a year or 2 or 3 or 4 or 5 years of basically just laid up eating pills all day to try to beat the pain. There's people that are in that situation that came out of that with kratom and wrote that on a, you know, comment to the FDA, and the FDA just ignored all that shit. Tens of thousands of comments. I think they broke a record with comments on this one. And the FDA just was like, nope, who cares about all that? Well, this study says that they're not bullshitting. They were actually telling you the truth. And then we have Dave Herman, chairman of the American Kratom Association, called upon newly appointed acting drug enforcement administrator Uttam Dilhan to return the FDA recommendation for scheduling of kratom back to the FDA for additional evaluation and research. Quote, this new study confirms the growing body of evidence that the FDA has demonized kratom unfairly, and the time has come to allow science to speak, not a basis against natural plants and herbs, Herman concluded. I agree. And another thing about it, finally, is that, you know, there's going to be an update. I mean, like I said, there's a lot of studies that have been done on kratom since the noise was made. I mean, not a lot, but a couple before this. And this is just, to me, this is the most prestigious one. This is again, the addiction biology, you know, this is the world's foremost addiction doctors and scientists basically get together like a bunch of nerds and try to get at the heart of this shit. All right. So they're not somebody that you would just like, oh yeah, they did a study, just a bunch of kids at, you know, UCLA or some shit having fun with sociology class. This isn't nothing like that. This is real, you know, in the lab with rats and shit, doing actual testing to see how addictive this shit really is. And the FDA needs to, this is, the ball's in their court. That's all I'm saying on that comment there. The ball is in the FDA's court. I don't see how they can continue to go down the path of Schedule 1, seeking Schedule 1 for kratom. There's just really there's no basis for it. I mean, what they're trying to do with the, you know, the FDA has compiled a list of about 42 or so cases where they say that people have died from kratom, yet it's just not true. None of the cases in there look like the kratom had anything to do with their deaths. And then another thing that they've done is that they've blown this kratom tainted with Salmonella thing out of the water. So you can tell the FDA is going after kratom hard. After this study, they have to answer to it. There's really no reason for them to continue down that path.